I'm Bhavin Shah. I've been an optometrist for over 20 years. I've been wearing glasses since the age of 13. I've been wearing contact lenses since the age of 17. Originally, I wanted to do something in the scientific and medical field. I saw optometry and it looked really interesting because there was a nice mix of dealing with people, using technology as well as looking at people from a medical point of view. Outside of work, I used to be involved in IT. I was actually designing websites and helping some small businesses with their IT as well. And then I went in to become a practice manager. At that time, I started getting interested in behavioral optometry as well, and how we make sense of what we see, how our visual system works. The company I was working for was taken over by a multiple company, and then I realised actually was my interest had changed, and I knew I wanted to take things in a completely different direction. I realised that was a time when I had to set up my own practice, so I could start implementing some of these ideas and start helping people in a much wider way. I developed more specialised services, looking at children's vision, looking at adults' vision. It gave me that freedom to be able to practice exactly how I wanted, what I wanted, and I could follow my own career path as well. Being a practice owner is completely different to being an optometrist. There's a lot of elements of the business and just actually generally being a leader. So it's quite a different role. It's a very, very rewarding role. It's a bit endless, so you end up working many more hours. It's exciting. It's not for everyone because it involves a lot of different kind of challenges. But if you like that kind of challenge, then it's a great option. 2014, 2015, I started getting involved with a few tech companies as well. So I've been doing work with eye tracking and trying to identify children who are poor readers by looking at their eye movements when they read. We've named the company Okimo. In 2017, we started looking at technologies, especially contact lens technologies for myopia control as well, and it tied in very well with the work that I was doing with children's vision as well. I could impact children and affect not just their lives now but in the future as well. Myopia control is essential, I think, for children who are myopic. One of the things is that their eyes often will be progressing quickly as well, so their vision will just get worse and worse unless we do have some kind of intervention. Being myopic gives them significant risk factors in the future, so they're much more likely to have a risk of retinal detachment, risk of cataracts, risk of glaucoma. So doing something now will protect their sight in the future. Moving forward, I want to do more work with technology. The practice has changed so much. In the last 10 years, there's been more change than there's been in the 100 years before then. And what I want to be involved in driving, shaping and influencing that technology. I want to develop my work with vision in children and how to improve particularly learning and reading. I just love the way that you can help people's eyes, you can help people's vision, we can make an impact on people's lives, and it's like a long-lasting impact. That's what makes it worthwhile.